Good evening, everyone. I know that people are just filing in, and we're going to get started right at the top of the hour. I'm Andrea Foti, and I'm the RCDSO's Deputy Registrar and Privacy Officer. I am pleased to welcome all of you to tonight's RCDSO Connect session on the AI Advantage, transforming dental practice in the digital age. This session, it will feature a presentation by Dr. Peter Fritz, and it will introduce you to the fundamentals of artificial intelligence in dental practice, with a special focus on data governance and privacy considerations. In the session, we'll explore how AI technologies such as machine learning and computer vision enhance diagnostic capabilities and practice management. The session will also provide essential frameworks for responsible AI implementation. Before we get going and get into the content, I just wanted to take a moment to share a land acknowledgement. While we're all in different physical locations, this acknowledgement will focus on the lands on which the RCDSO offices sit. So the RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. These traditional lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. And we embrace our role in regulating dentists, in protecting the public interest, and strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. So with that, I'd like to turn now to some introductions. We're very fortunate tonight to have as our presenter, Dr. Peter Fritz. Dr. Fritz transforms healthcare at the intersection of clinical innovation, technology, and law. He's a practicing periodontist and is chair of the Royal College of Dentists of Canada's Committee on Artificial Intelligence. In that capacity, he's leading the development of national standards for AI in dentistry. With an LLM in innovation law and technology, an MBA from Kellogg, and a PhD in molecular biology, Dr. Fritz is recognized for advancing frameworks that demonstrate how AI can enhance, rather than replace, clinical excellence in patient care. We're also pleased to be joined tonight by Dr. Louisa Schult, who will be supporting our session and responding to your questions during the presentation. Dr. Schult is a dual certified specialist, having completed Royal College dental examinations in periodontics and prosthodontics. She is committed to the advancement of both of these fields through the delicate balance between evidence-based decision-making and the application of cutting-edge technology. She practices in Fonthill, Ontario. And as you listen to the presentation this evening, we encourage you to put your questions in the chat using the chat function. We've got a large group tonight, so it may not be possible to respond to every question, but Dr. Schultz will respond to as many questions as possible. When you are entering a question into the chat, please just remember to select everyone so that all of the attendees can see those questions and then can see the answers, and we can benefit from that learning. So I hope you enjoy this great session, and I'll now turn things over to Peter.
All right, thank you very much. Andrea, can you see that okay? You have a thumbs up on that?
Yeah, looks
Excellent.
good.
Well, thank you for that very kind introduction. It is such a pleasure being here today. With that introduction, it's a little bit long. I think we need AI to decrease that. Because when it all boils down, I'm just a periodontist. I'm a specialist. And do you know the definition of a specialist? The definition of a specialist is someone who does almost everything else worse, right? And I'm not a specialist in AI because, frankly, there are no specialists in AI yet. But for the past 18 months, I've had the privilege of leading the Royal College of Dentists of Canada's Committee on Artificial Intelligence. And this committee has established itself as a leader in AI applications across dentistry. And it's been really a pleasure working with this group. But my goal today is simple. I'm here to teach fish how to see water. AI is the water all around us right now. It's above us, it's below us, and soon will, like a Wi-Fi connection, it's inseparable from our day-to-day functioning. Most of us swim through it without even noticing it's there. And as dental professionals, we pride ourselves on our exceptional ability to learn and adapt. And as intellectual couriers and leaders, you're here to make some decisions. You want to understand the real impact of AI on your practice, but there's so much noise out there, it's hard to know where to begin. Like, I'm here to help. By the end of this session, you're going to have gained a significant advantage and over anyone not at this lecture. And you're going to have the power to take steps to make some solid decisions that'll help you integrate AI, not someday, but starting today. Does that sound okay? When faced with complexity and uncertainty about the future, our natural instinct is to seek simple and definitive answers. But with AI, those answers just don't exist. There are no true experts in this field because it's evolving just too rapidly. I don't have all the answers. I don't even have all the questions because many haven't emerged yet. What I can offer you, though, is something perhaps more valuable. I can offer you the perspective of a peer and a colleague who has invested thousands of hours using AI tools in a clinical setting. And this isn't theoretical exploration, it's a practical implementation driven by the desire to both become a better dentist and a more efficient one. So today I'm going to share some insights that you might find surprising. I'm going to share some sensitive information about how AI is transforming dentistry in ways most haven't recognized yet. Consider this like an insider's view of someone who's been swimming in these waters and can now see them clearly. But first, I need to share two frameworks with you. The first is on trust. Do you know there are 3 pillars of trust? The first pillar is honesty. This is straightforward to verify. If I tell you the watch strap on this video is white, you can see for yourself whether that's true. Honesty creates the foundation for trust. Secondly, the second pillar is competence. Competence is demonstrated through credentials, like the diplomas hanging in your office that show you've done the training to practice dentistry. I trust my assistant Candace, but I wouldn't trust her to remove my appendix. Not because she lacks integrity, but because she hasn't been trained for that specific competence. The third and most crucial pillar is benevolence. Benevolence means I'm sharing information because I generally believe you need to know it. And you need to know what I'm going to tell you about AI. Tonight isn't about me. It's about what you need to know. So benevolence is the hardest element to fake. It's the one patients and the ones that you can see through instinctively. These 3 pillars, honesty, competence, and benevolence, they exist within a sphere of vulnerability. The vulnerability is I don't have all the answers, but I believe together, as a group of remarkably bright and talented professionals, we can navigate these challenges and discover solutions collectively together that are going to elevate us and help us navigate the future better using AI. So before we begin, I have one more framework, and it's really important I share this with you. In 2018, I took 2 courses at IMD in Lausanne that transformed my career. The one was on crisis management, which proved invaluable during the pandemic. The second was on orchestrating winning performance, which introduced me to this concept called the VUCA world. To truly appreciate the impact of AI, you need to understand the VUCA framework, and that's characterized in our world. The VUCA world is how sort of things were before 2019. V stands for volatile. Our world is characterized by rapid, unpredictable change. Things move at lightning speed in ways we can't anticipate. And creating an uncomfortable environment for decision-making is what the volatility creates. The U is for uncertainty. There's variation happening around us, but within known limits, people generally cooperate in relatively predictable ways, and the world unfolds as we might expect it to, but significant variation demands our attention. Complexity. Boy, this world is complex. The complexity of our environment is astonishing. We're bombarded by countless relevant factors simultaneously. Many suffer from what I call informational obesity. People are gorging themselves on bad information. That's easy to digest and consume, but it's just so unhealthy for them. And the A stands for ambiguous. In this world, quite often, there's either no clear response, no clear good response, or there are many responses without obvious advantages. This ambiguity makes it so difficult to move forward with confidence. So this is the VUCA world. This is the uncomfortable world. This is where we were. What keeps us anchored in the VUCA world are two critical elements. One, relationships, and the two, information, and preferably reliable information. When relationships and information are disrupted, for example, during a pandemic that reduced our connections to two-dimensional conversations, or when information becomes micro-targeted to reinforce rather than challenge our views, or when there's geopolitical instability, we don't just remain at the VUCA world, we transition to something more dangerous. And it's called the EPIA world. E stands for explosive. Changes happen here, not just rapidly, but destructively. P is for polarized, where middle ground disappears and extremes dominate. I stands for irrational, where emotions override evidence and logic. And A is adversarial, where collaboration collapses and competition and conflict raise up. Do you see any parallels in today's environment? The best that we can do is push back, rebuild relationships, share quality information like we're doing here today, and guide ourselves back to the manageable VUCA world. But here's the critical insight for you as dental professionals. Artificial intelligence is accelerating the shift from VUCA to EPIA, fundamentally altering our relationships with patients, with staff, with colleagues. It's going to transform the information landscape completely. As leaders in your practices and communities, you must understand that this transformation is happening and you need to navigate it successfully. Okay, those are the frameworks you need to know. This is why what I'm telling you is really important. We're in the middle of a general purpose technology transformation. Throughout history, we've experienced what economists call general purpose technologies, innovations that completely transform how we work and how we live. Steam power revolutionized manufacturing. Electricity illuminated our world. The internet connected us globally. Now, AI joins this elite category, but with a crucial difference. What makes this revolution unique isn't about installing new equipment or learning new software. It's about fundamentally changing your mindset. AI represents intelligent assistants that enhance everything we already do, amplifying our capabilities rather than replacing them. And AI is actively changing our relationships with patients, colleagues, and information. It's completely transforming how we access, interpret, and create information. Everyone's a creator now. And it's doing it today, right now, in real dental practices across the country. This isn't future hype. This isn't speculation. This is your present reality. And this is your potential competitive advantage. So the FDI, World Dental Federation, just released a policy paper on AI that's directly relevant to us as dental professionals. This guidance provides a framework on policy for how we should approach AI integration into our practices. The timing couldn't be better as we navigate this rapidly evolving landscape. And so just to define what AI is, they define AI as the capability of a technical system to acquire, process, and apply knowledge. And the theory and development of computer systems able to perform tasks normally requiring human intelligence, right? So what does this mean for dentistry? Most AI applications we encounter use machine learning. They analyze massive training data sets to identify patterns. It's just like a really sophisticated multi-billion-dollar autocomplete program that's able to predict, just like on your phone when it autocompletes and it's sometimes miserable, it's able to autocomplete what you're looking for. And it isn't theoretical anymore. It's already reached clinical maturity in many healthcare applications across computer vision, natural language processing, and some robotics. And let's define some of that. One of the best repositories or clearinghouses of AI terminology that I've ever seen is in Ontario Healthcare. That I found is in this link here, the Center for Effective Practice. Here you can learn all about the definitions of these various AI tools and their backgrounds. You can go into a lot of detail, and it's really done in a digestible way. But these technical terms represent different AI capabilities transforming healthcare. These are the list on the left. But kind of like the mechanics of your handpiece, what matters most to dentists is the practical application rather than the complex inner workings of how your handpiece works. So if you're really interested to see how your handpiece works and you want really good definitions for these things, take a screenshot and follow the link. It's really well done. Just as we don't need to understand the intricate air pressure systems and bearing technologies to our handpieces to perform excellent restorations, you don't need to master these technical competencies to benefit from AI tools in your practice. And I'm going to introduce the principles on the left throughout my presentation, so you can see some practical examples instead of going through them in minutiae. Instead, I want to talk about a metaphor that I like. I think of an AI system as a restaurant. We've all been to restaurants. We can identify with this. And you can imagine AI as a restaurant, but not just any restaurant. It's the one where you bring your own ingredients. And in the world of AI, these ingredients are your data or your input, right? And this data or your input forms what's called the prompt. And the prompt is what you bring to the kitchen. And inside the kitchen, it's a sophisticated kitchen in this restaurant with specialized tools and equipment. And these represent the AI's algorithms. And these are like predefined recipes designed to handle specific tasks. And the kitchen staff here is trained to use these recipes efficiently. And what makes this kitchen really special is that it has access to an enormous cookbook containing virtually all of human knowledge. And the staff can reference this vast collection of recipes and techniques as they work out the ingredients. So you hand over your ingredients, remember the prompt or the data. The kitchen staff examines what you've provided and decides which tools and recipes create the best dish. They might chop and cook it and put it in various combinations. And then you receive the final dish. The final dish is the AI's output. And the quality depends both on the ingredients you provided and the skill of the kitchen in executing the right recipes. Now, here's where things get really interesting. There are daily variations. If you come back tomorrow with exactly the same ingredients, you put exactly the same prompt in, you'll get a slightly different meal. Perhaps the chefs are in a different mood or they've rearranged the kitchen slightly overnight. But similarly, AI can produce varying results with identical inputs. There are unexpected dishes. Sometimes you order spaghetti, you think you're getting spaghetti, and out comes a schnitzel. And this happens because the kitchen can hallucinate, especially when it's been running all day and the staff is tired and who knows what happens late at night in a restaurant kitchen. But the AI might confidently create content that seems plausible, but actually is incorrect or completely fabricated. So what's key is the diner's responsibility. It's up to you, the diner, not the chef, to determine if the meal is good or even if what you ordered. Because the AI won't tell you when it's made a mistake. Like any restaurant, the responsibility for quality control falls on the consumer. So understanding dental professionals for this is really crucial because we have the quality of our ingredients is the information we bring to the AI tools. It directly affects the quality of what we get back. So a poorly worded prompt or incomplete data is going to produce less useful results, just as poor ingredients are going to limit even the best chef. And what you really got to watch out for these days is that bottle of AI steak sauce. It's on every table, this AI steak sauce, and it promises to make everything taste better. But sometimes it just covers up the flavor of what you're actually eating. Just like our patients who Google their symptoms before appointments, a little sauce can either enhance or completely confuse what's really going on. All right. So just like there are all kinds of restaurants, from fast food joints to Michelin-starred establishments, there are many different AI tools available today. And similar to how restaurants vary in quality, price, and safety standards, AI tools come in various levels of risk. You might be surprised to learn that we don't yet have a comprehensive regulation governing AI, even in healthcare and dentistry. We're essentially in a bit of a Wild West phase of AI adoption, where the technology is racing ahead of regulatory frameworks. The European Union has emerged as a leader in this space with their AI Act, which was formally adopted in March 2024. But let me be clear, we're not bound to operate like this in Canada. But the framework really makes sense to me. It provides a risk-based framework that categorizes AI systems according to the potential harm they could cause. In Canada, we have the Artificial Intelligence and Data Act, Bill C-27, which was actually introduced before ChatGPT became available. So this bill is currently moving through Parliament, but hasn't been updated, and the many recent developments in AI aren't reflected in this, and it'll probably be killed with the new election. But anyway, the key I want you to take from this slide is to assess the potential harm that could result from an AI system failure. You have to figure out what kind of risk it had to begin with. For example, in your office, you might play Spotify on your music system. And whoever controls the Spotify playlist in the office, they really have the power. But anyway, the Spotify playlist is an example of a minimal risk AI application. The toothbrush app that you're using, that also is a minimal risk app, which needs to be regulated differently or thought about differently than a high risk application, such as diagnostic radiography or record keeping. And then we have another level of unacceptable risk, right? And this is like autonomous robotic surgery, right? We don't need that. We'll never need that. So the FDI document I told you about earlier gives dentists some really sound advice. Number one advice is learn the basics of AI. Dentists should understand the fundamentals of AI to make informed decisions about its use. It's not like it's going away. You want to make evidence-based decisions. Whether using AI or not, decisions should be based on solid research and the principles of evidence-based dentistry. You want to evaluate your AI tools carefully. Before relying on AI in dental care, assess how useful and relevant it is in a real-world setting, and consider how accurate it is, whether it applies to different patient groups. What's the financial impact on patients and insurers? And you want to use AI as a tool, not a replacement. AI should support, but not replace human judgment. Dentists must stay aware of potential biases and remember that they're ultimately responsible for the diagnosis and treatments. I'm going to say that a number of times tonight. Back to bias. A lot of people think bias is bad. I think bias can be a good thing. Here's how. My operating room in my clinic, it's biased towards being sterile. And everything that I do in that office, in that operating room, has a bias towards being sterile. This bias serves a purpose, and everyone knows there's a bias. So bias can be useful, but you have to be careful with it. So doing something new, yeah, visiting new ecosystems. We had to do a lot to get from the EPA world, from the pandemic back to the VUCA world by reestablishing relationships and sharing good information. But now we have AI that's disrupting things. Like, why do we have to do this? Why do we have to attend RCDSO Connect? Why is this critical? Because staying the same is like just so much easier. Like, don't bug me. It's just a pain to change. I know. But let me tell you a campfire story about how I got into AI. I first started using ChatGPT in December 2022. And shortly after, I had a transformative experience that hooked me. This experience fundamentally shifted both my approach to technology and my commitment to understanding AI for compassionate patient care. I had this patient come in to see me. She came in with her husband, and she was miserable. She was frustrated, she was miserable, she was in constant pain for the past 6 months. She'd seen various clinicians along the way and could not get a handle on her pain. So, what happens when you run out of options, you go see the country dentist or the country periodontist in Fawn Hill, and they try to take a look at it. So she came in and I said, what's the problem? She said, I'm having mouth ulcers, and these mouth ulcers are just ruining my life. And I'm like, mouth ulcers, Aptus ulcers, okay. So tell me more. And she's like, they just come and they go. They're for about 2 weeks and then they go away. But I just feel so miserable because of these things. I'm thinking, okay, this doesn't fit to me because this is really disproportionate. Is she drug seeking? Is there more to this story? What's going on? Her husband just says, I just need a solution for this. This is really consuming our lives. So I said, okay, let me take a look. And I said, is anything else happen around these things, these mouth ulcers? And she says, well, sometimes I get a rash on my face. I'm like, okay, do you have the rash today? And she's like, no, I don't. So I'm like, okay, all right. So I look in her mouth and examine her and to the best of my ability, and I see some canker sores, some aphthous ulcers. And I'm like, okay, well, this looks like aphthous ulcers. They last about 2 weeks. I'm not going to add a lot to this conversation. I said, have you had a biopsy yet? Because I think like a surgeon. And I'm like, if you haven't had a biopsy yet, that might be the next logical step. And she says, no, I haven't, but I'm not sure I want one. It's expensive. And is it going to tell me for sure what I have? I said, no, it's not going to tell you for sure, but it's going to help us get some more information. And really, it's the only thing that I can think that hasn't been done before. So I said, think about it, come back, and maybe come back when it's like worse. And then like we can have another look at it. So 2 days later, she's in my chair. She has some additional mouth ulcers. And I'm like, okay, we do the biopsy. She's really not a happy lady. And I send it to a university pathology lab. It takes them 2 weeks to give results. A week later, she's calling. I need to come in and see you. I'm having such pain. I just can't manage. Can you help me? And I'm like, I don't have any new information, right? Like, what am I going to do? I don't know how this information yet. She's coming in at noon. At 10 a.m., the pathology report comes in. Here it is. Tissue from distal aspect of tooth 1-7, acute and chronically inflamed granulation tissue. I'm like, great. This is of no help at all, right? What am I going to do with this? And in addition, the pathologist noted the crush artifact on my specimen. So I'm like, okay, she's coming in 2 hours. Like, I don't know what I'm going to tell her. So I decided that usually I would call the pathologist and talk it over with her. But in this case, I thought I'd use this new technology called ChatGPT. So when I first started using chat, I had no idea what I was doing, what prompt engineering was. I approached it like a search engine, which it is not. It's absolutely the wrong approach. More on that later. Nevertheless, I typed in the sample line, differential diagnosis for a patient with painful recurring mouth ulcers and a facial rash. And in a second, the first suggestion that appeared was Behçet's syndrome, Behçet's disease. And that moment changed everything for me. ChatGPT didn't stop at Behçet's. It provided a comprehensive differential diagnosis, including the usual suspects like lupus and pemphigus that you see here. But my clinical judgment told me those common conditions didn't quite fit the patient's presentation. So instead of dismissing the AI's first suggestion, I decided to investigate Behçet's syndrome further. Tell me what you know about this, right? So let me tell you, I hadn't heard of it since dental school. So I went back to my Neville oral pathology textbook to verify the information that Chat was giving me. And what struck me was how ChatGPT's explanation was actually clearer than my trusted textbook. So I verified the information was good, and I printed the AI-generated information and brought it to the appointment with the patient. And this allowed me to have a conversation with the patient previously with something that wasn't even on my radar, right? So we sat down and I said, listen, I've got to ask you if you have anything, a few questions about this. You have some more ulcers today. Do you have any ulcers anywhere else? Do you have any genital ulcers? And she said, yes, I have genital ulcers when these come on. I said, well, what about blurry vision? She says, yes, I went to the optometrist, and the optometrist was, told me that I can't have new glasses for another few months because my insurance won't cover it. I said, the facial rash. She said, yes, that comes on every so often, usually, a couple of days before. I said, numbness in the extremities. She says, yeah, that's why I saw the neurologist. And as we went through the specific symptoms of Behçet's syndrome, I watched her face transform. With each symptom I mentioned, she nodded with increasing enthusiasm. Yes, I have that. Fever, yes, I have that. That happens to me too. She wasn't just acknowledging the symptoms, she was experiencing the profound relief of being understood. For perhaps the first time, someone was connecting the dots for her seemingly unrelated symptoms. The excitement in her eyes said it all. Like, I'm not crazy. This is real. There's a name for what I've been experiencing. And, I wrote Behçet's disease on a piece of paper and I told her, take this to your family doctor and ask them to investigate this specifically. She left, she was beaming. I'd never seen her smile before. She was so happy. And you know what? That's exactly what it was. So what's remarkable is that every clinician she'd seen, her dentist, her hygienist, even her waiter, had access to the same exact information that I did. This perfectly demonstrates the disintermediation of knowledge happening right now. Just 6 months earlier, making this connection wouldn't have been possible. AI allowed me to solve this patient's puzzle in a way I'd never experienced before, not replacing my clinical judgment, but expanding my knowledge, and I can quickly access it chairside and help the patient. So that's when I said this technology is just absolutely amazing. So we started integrating AI-assisted radiographic interpretation into daily practice. And it's been a journey with its share of frustrations, but I've watched the technology steadily improve. While these tools aren't fully mature, their potential is remarkable. They're like a kitchen assistant who's still learning the recipes, but can occasionally get things wrong. But they can occasionally see things that I can't see, and they pick up on these things. So it doesn't replace my diagnostic skills, but rather it provides like a second set of eyes. So here's kind of how it works. Think of it as like, you're thinking again of that autocomplete system. When you use it, the system methodically examines every tooth, highlights pathology, such as potential decay or periapical radiolucency, because it's been trained on millions of radiographs to predict what conditions might be present, what else looks like this, what is the vision, what the computer vision of this. And for each finding, it assigns a probability score, essentially saying I'm 85% confident that there's decay here, or I'm 90% sure that that this has a periapical radiolucency. But here's where our expertise becomes critical. I still need to approve or adjust what it shows me for every tooth. And it's like having a terrible answer key to a test. In dental school, we had the practice tests and then there was an answer key. Like, who the heck made this answer key? Like, this is awful a lot of the time. Mostly it's right, but every now and then they're like, this can't be right. So this technology might flag something with high confidence that isn't actually there. And it can miss things that my trained eye catches that it hasn't been trained to catch. And that's why I'm also always the final decision maker. And it's the perfect illustration of human AI collaboration. This high-risk technology enhances my capabilities like an augmented superpower rather than replacing me. But years of dental training and experience provide the context and judgment that the algorithms just don't have. And you need to be a dentist to use this. The market also offers several AI radiographic AI analysis programs. I've experimented with most of them. What you're seeing here is another program which offers a capability to calculate the percentage of decayed, missing, or filled tooth structure. This isn't just clinically useful, but it's integrated to insurance companies in the US, and the carriers can now use these objective AI measurements to determine coverage eligibility for full coverage restoration procedures. So you can say, okay, this tooth is 80% decayed, missing, or filled, and maybe a crown is indicated now, and that streamlines that approval process. But beyond caries detection, these programs are really good at calculating radiographic bone loss, which also is really helpful. And pretty soon I see the technology where you scan the patient, you get a soft tissue scan, you superimpose that on a CBCT, and then you're going to have the ability to perform periodontal probing virtually without physically touching the patient. That's a little ways off, but not that far. But here's what I've learned from my 2-year adventure with radiography, with AI digital radiography and diagnostics. These are high-risk applications. They demand careful integration. They should enhance your diagnostic capabilities, not replace your clinical judgment. Think of them as like sophisticated kitchen assistants in our restaurant metaphor. They're not the executive chef. Be vigilant about the risks of over-reliance. these systems often produce false positives, and they can be really aggressive in identifying decay. It's frustrating how aggressive they can be. And the false negatives, if there's a keratocyst in your field of view, there's really no chance it's going to pick it up. It's very unlikely that it's going to pick up any sort of serious pathology. So this is precisely why these tools require a trained dentist to interpret the results. And you bring the contextual understanding and clinical experience that the algorithms just don't have. So the technology is immature in many ways. It's powerful, it's still developing, and it's going to be great, but it's still got a ways to go. So AI is a powerful diagnostic aid, but always apply your critical thinking to every recommendation it makes, because it never tells you if it's wrong. The responsibility for diagnostic accuracy, patient safety, and ethical decision-making, they rest squarely with you, the clinician. AI doesn't change that. So I want to walk through a practical scenario that's already happening in dental offices today. Take an x-ray of the patient's teeth. Instead of relying solely on the dentist's expertise, it gets run through an AI diagnostic program that analyzes the images. The software returns a result, 53% probability that there is decay in tooth 3-6. Now comes the critical moment. You share this information with the patient. But what is actually happening in this interaction? Is AI adding to your relationship with the patient? Is it a collaborative tool? Or is it quietly competing with your expertise? Consider it from the patient's perspective. It's much like when you bring your car in and the mechanic says, our computer diagnostics show you have 10% left on your brakes. In that moment, are you trusting the diagnostic tool or are you trusting the mechanic? This is a delicate balance that we have to maintain, and patients may wonder if they should trust the AI, trust you, question both. When the AI and your clinical judgment come together, like that's reinforcement. But what happens when they differ? How do you handle that situation? So we have to be extraordinarily careful about how we incorporate these tools into our practice, not just for diagnostic accuracy, but for the preservation of the trust relationship that sits at the heart of dentistry. I didn't become a dentist so I could be a glorified waiter. And we have to be really careful about growing industry pressure to adopt AI tools for everything without proper scrutiny. I'm seeing alarming trends in our profession. Colleagues are attending webinars where presenters casually suggest, why would I send a CBCT to a radiologist anymore? If there's a problem, I'm just going to blame the AI. This represents a profound abdication of our professional responsibility. Others are complaining, I can't hit the approve button fast enough. There should be an approve all button to save time. You can't have blind faith in anything today, let alone AI. Also concerning, I've seen dental assistants, dental hygienists conducting them seminars on implementing these advanced diagnostic tools. This is particularly problematic because these team members, despite their valuable skills, lack the specialized expertise to navigate high-risk diagnostic technologies that demand advanced radiological training that we have as a dentist. So our ethical obligation is to maintain clinical judgment and responsibility. That's our job. Never to outsource it to an algorithm or pass liability to a software company. So the consequences then, they impact our patients and our practices. All right. I told you we're operating in a regulatory vacuum right now. Wonderful. There are really no regulations governing how this AI technology is being used in dentistry, largely because the technology is moving so much faster than legislation can keep pace with. Fortunately, the RCDSO is a leader in this area. Alex Wong, Cameron Thompson are writing a very important document for AI guidance to help us as dentists figure out how we should be implementing this. And this is going to help us frame AI in a more structured context for dentists in Ontario. And I believe it's going to set the bar for North America. I can't wait to see it. A few years ago, I wrote about the shifting risk landscape in dental radiography with AI implementation, and it highlighted how extraordinary our current moment truly is. Consider from a historical perspective. From the Gutenberg press in 1440 to approximately 2015, We can put parentheses around this time, 1440, 2015. This is where we had advancement due to knowledge and expertise. But after 2015, this is something totally different. Scholars have called this the post-truth era. In the post-truth era, many people place greater trust on social media platforms and entertainment sources than they do in scientific evidence. The algorithmic recommendations that drive these platforms often value engagement over accuracy, creating echo chambers that can undermine scientific consensus. So as dental professionals, as scientists, as healthcare leaders, as leaders in the community, we have a critical responsibility to push back against the war on science. We have to model and implement the principles of the scientific method in everything we do, and especially how we adopt AI technologies. We can't allow convenience or marketing to supersede this evidence, and the trust the patients place in us demands nothing less than a rigorous scientifically sound implementation of these powerful new ideas. Let me introduce to you what I call the AI mindset. This is about approaching every element of your work with one crucial question: how will AI help me? This mindset isn't about hype. It's not about installing expensive new equipment or mastering complex software. It's about recognizing that you now have an intelligent assistant that can enhance everything you already do, and they're with you all the time. Let me show you a quick example. I was lecturing in Florida, and I spotted an interesting bird on the beach. I wonder, what kind of bird is this, right? Took a picture of it. My best guess, orange-billed white beach bird. Right? But the AI technology already in my smartphone instantly identified it as an American white ibis, just from the photo I took. Right? That blew my mind. The technology just didn't provide information, but it expanded my awareness right in the moment. This is the real power of AI. It augments our existing capabilities without requiring us to be technical experts. Here's another practical example of the AI mindset in action. This image shows an instrument sitting on my counter in the Steri Center. I take a picture of it with my phone using ChatGPT, and I ask, what is this item from my dental kit? And AI immediately identifies it as a Nobel screwdriver, specifically designed for their implant system. Not only that, I can ask, how do I order it? What's the SKU number? And it'll help me order replacements. Think about what that means for your practice, right? Especially new assistants learning new systems. They now have an intelligent resource that transforms how they learn and how they identify instruments. The cognitive load of memorizing hundreds of specialized tools shifts to recognition and verification. What's remarkably is this capability wasn't available 4 months ago, right? That's how rapidly AI is evolving. The underlying technology is this new AI steak sauce, as I mentioned earlier. It continues to improve at an unprecedented rate. So let me walk you through again about how we've transformed patient care from AI in 2022 to the present. And what you see on this slide isn't theoretical, it's our actual implementation across 3 areas. Now, it isn't perfect, but we're pushing through a lot of these initiatives. We're using AI in assisted treatment planning, radiographic analysis, and documentation. The time saved isn't disappearing, we're just redirecting it. For patient experience, we're creating AI-generated treatment brochures, multilingual communication tools, and interactive consent forms. Our practice operations really benefit the most, though, through insurance correspondence automation, intelligent email management, and inventory control systems. This allows us to focus on other things. The key takeaway isn't just the total hours saved per week, it's how AI transforms your time usage in the practice. These aren't hypothetical gains, they're measurable improvements we've achieved. And every task that you go into, you need to think, how can AI improve this? Because what will happen is your people will be more efficient, they'll sound smarter, and they'll be more polished. I like to say innovation is creative destruction. It isn't easy, but you learn a lot. Let me emphasize 5 critical insights we've gained from this experiment in our living laboratory for the last couple of years. AI doesn't replace expertise, it amplifies it. The clinician remains the decision maker, with AI providing enhanced precision and efficiency where it matters most. The value isn't in the technology, it's in the people using it. professionals, team members. Your team members skilled in AI, they become more valuable, not less valuable. They're far more valuable if they can use this technology. But they're going to be more expensive. They're going to be harder to replace, which means strategic investment in talent and training is essential. Third, the ROI extends far beyond simple time savings. You can measure efficiency gains, but the real value comes from elevated diagnostic accuracy, potentially improved treatment outcomes. We haven't extrapolated that far, but I can see it being better. And definitely enhanced patient experiences. They're all driving long-term practice success. It also allows us to focus on high-value activities. By automating routine workflows like inventory control, we dedicate more time to complex procedures and meaningful patient interactions, right? But let's be honest, AI implementation is not easy. It's disruptive, it's challenging, and it's costly. We've learned this firsthand. And if we use the storming, norming, performing analogy, we're probably still in the far side of storming, right? It's getting to be normal, but it's been a process getting there. But the applications throughout our practice, not just the clinical applications, but the team management, performance reviews, training program developments, candidate assessment, these technologies, the technology saves tremendous time, but it's not a magic solution. We're still figuring it out ourselves, and it's very far from being perfect. And it's a significant investment both in time and money, but we view this disruption as necessary to future-proof our practice against the massive changes already shaping dentistry. I'll show you a little bit about the record keeping. Our record keeping journey involved in distinct phases. This is the first one. We first started with ChatGPT when it was version 2.0 emerged, which experts described having the brain of a honeybee. Each subsequent version has grown more sophisticated with ChatGPT 4, the brain like a hamster, and to today's most advanced capabilities with the O1 being a reasoning version, maybe smart as a talking dog. Our initial approach was straightforward. You wrote down what you did. Let's say create a surgical chart for placement of a dental implant, tooth 2.5, no bell, whatever, routine surgery following RCDSO guidelines, which you would put in for record keeping. The AI tool would then generate a comprehensive chart entry instantly, which you converse with. And I'd ask, what else do you need me to know? What else do you need to know to make this a stronger chart note? And it says, well, you're missing this, this, and this. I'm like, okay, I talk to it and I say, I'm adding this, I'm adding the medical history, more I'm adding this. And then it just rewrites it, right? But let me emphasize a critical point. You should never input patient information into these systems. For patient information, there is something better. It's a medical scribe program, like Scribeberry or Heidi. And what these do, and you may have seen these in your medical offices because they're used a lot in medical offices. Here's how they operate. You get consent from the patient. We'll talk about that in a second. They come in, there's a microphone in the operatory. You have your consultation with the patient, and the recording program captures the conversation. It distills the conversation into structured, relevant clinical notes. You review and approve these notes and say, yes, this is a faithful representation of what went on. And then you cut and paste them into your electronic record system. And this system can automatically generate customized letters to referrals, to insurance letters. It's really amazing. But where I think it's really fantastic for the patient is at the end of the appointment, you can create a personalized patient education material tailored to that individual. So you have a consultation with a 25-year-old ballerina. This is what we talked about in our consultation today. And it's tailored to the 25-year-old ballerina or the 60-year-old French-speaking lumberjack, right? Covering exactly what we talked about today during our visit. So the progression represents not just time savings, but a fundamental enhancement in patient communication and care documentation. All right, let's talk about informed consent for AI in dental practice. When reflecting on my own experience as a patient, I've noticed how medical offices handle this. I've signed documentation acknowledging that AI is going to be used to record conversations. I see the signage in the waiting room explaining the AI presence, and that's it pretty much. So we've added a conversation with the patient where as the assistant is walking down the hall with the patient, they have a chat about, did you see the sign? Do you have any questions? Before they get into the room. right? So you want to establish consent to use this technology before the patient goes in the room. And this is a 3-layered approach: the written documentation, the visible notifications, and direct conversation. And this creates, in my mind, a reasonable network consent framework. I'm sure that the new guidelines that are coming out by the RCDSO are going to amplify this. You should document that the patient has consented to this at this point. Patients have the right to opt out at any time. And it's the consent is specific, right? So this is where we go, and we're going to be wrestling with this AI technology versus, is it going to become as common as, like, if I use the internet to help my patient, do they have to consent I'm using the internet? Right? There's some questions around this, but for now, because the technology is so new, we need to be cautious, and we need to establish consent before using this. Now let's revisit a critical concept that we touched on earlier, the concept of prompting. Prompting is the key to making this all work. You are not working with a search engine. You are not working with a search engine. You are not working with a search engine. While AI may be built on advanced science, effective prompting is an art form. Just like the ingredients of the restaurant analogy determine the quality of the meal, your prompts determine the quality of the AI output. Creating effective prompts, the way you design this, fundamentally shapes what you receive in return. And this is why prompt engineering has emerged as a distinct critical skill for AI. So during our workshops, we guide practitioners through practical examples that demonstrate the dramatic differences between a mediocre and a masterful prompt. The same AI tools can produce radically different results based solely on how you frame your request. For example, if you add an exclamation mark after a prompt and you do one that doesn't have the exclamation mark, you're going to get a different result. If you offer the AI system a fake bribe, so you say, I'm going to give you 50 grommets if you do a great job with this, you're going to get a different answer than if you don't. If you tell it, you give your prompt and you say, if you don't get this right, my boss is going to make me cry, you'll get a different prompt, a better output than if you don't write that in. So the most successful people using AI today aren't necessarily the most tech savvy. They're the ones who've developed an intuitive understanding of how to communicate their needs clearly to these systems. Let me walk you through a practical example how the significant distinction is in a clinical setting. So what you're seeing here is a laboratory report for a patient with a potential liver function concern. And unless you're wearing your loupes right now, it may be difficult to read in this format. But it represents a common challenge that we have: complex medical data that requires careful interpretation, right? And this is precisely where the AI mindset transforms our approach. So rather than spending time researching reference ranges and trying to correlate these multiple values that you're maybe not familiar with so well, you can simply ask the AI tool to analyze the report, right? So how would you design your prompt? What would you ask Claude here? Claude is a frontier program. It's kind of like ChatGPT, but I use Claude for this purpose, and I'll explain why in just a second. So I've structured the prompt in 3 critical parts. Each serves a specific purpose. The first part is you always give the AI a persona. You have to tell it who it is. So I'm telling it, you are the director of laboratory medicine at Mount Sinai Hospital, advising surgeons on potential adverse outcomes for patients during surgery. And this immediately frames the AI's role, its expertise level, and the purpose, creating context that shapes everything that follows. So you got to tell it what it is. Second, I state my request. Please analyze the current lab results and advise me of responsible next steps. This direct instruction tells the AI exactly what I need. And third, this is crucial, I include a self-improvement mechanism by asking, before you do this, what else do you know? What else do you need to know to make this give me a better solution? Right? This invites the AI to identify gaps in the information I provided, helping refine my request before analysis begins. So this 3-part structure dramatically improves the quality and relevance of AI responses compared to vague requests. You might have said, like, help me understand these lab results, but this structured approach is the difference between receiving generic information and getting tailored, clinically relevant insights. So this is what the answer it gives me. It says, as laboratory medicine director, I need several key pieces of information to provide proper guidance. And it's asking basically to give it the lab results. You see, I haven't given it the lab results yet. But when I'm looking at this, I'm saying, is this reasonable? And it needs to be a clinician that says, is this reasonable? Does this make sense to me? Is there anything I want to challenge with this? Because if you're, for example, a lawyer and not a dentist, everything could be sounding reasonable with this situation. You don't know, it sounds really good and it never tells you it's wrong. So then what I do is I take the PDF, which is de-identified. It doesn't have any patient information in it. And I've specifically chosen Claude for this analysis rather than ChatGPT because of a critical privacy distinction. Claude offers a significant advantage in healthcare settings. By default, it doesn't use the data that you input to train its underlying models. This is fundamentally different from ChatGPT's approach to data handling. But Claude's policy states, by default, we will not use your prompts and conversations from free Claude AI or Claude Pro to train our models. But you know what? I don't trust them. A critical reminder, these AI systems maintain conversation memory during active sessions. So I can't be sure that this patient information is safe here. So you always ensure that you've thoroughly removed any identifying information before uploading any patient documentation, regardless of which AI system you're using, unless it's an enterprise version. Okay. So what you're seeing now is the output from Claude. And I wrote, good job, buddy. It seems you understand what I'm telling you. Now, please analyze the results below and help identify the most important findings in relation to the planned implant surgery. If you do, I might polish your transistors. This is the bribe I'm giving it. So now it gives several reasonable recommendations that it does, but the decision-making is firmly in my hands. And this interaction amplifies the AI mindset in action. And the system takes complex lab data, identifies clinical patterns, and provides context and suggests evidence-based next steps while maintaining an open dialogue throughout this. So the balance between powerful AI assistance and human clinical expertise represents the future of dental practice. So this technology just augments our capabilities without attempting to replace our essential role as healthcare providers and decision makers. It's a partnership role rather than a replacement. And it's the true promise of AI in dentistry. And I'll show you what really surprised me. I said, I was really happy with the result. I said, you're going to have polished transistors soon. And it said, thank you for the feedback. I see you're trying to make a joke. It's good your surgical skills are definitely more impressive than your comedy routine, something like that. It's just, it was staying focused. It wasn't going to go offside. So now I know at least I'm not funny in real life or in AI. I want to emphasize go back to the confidentiality part, the patient confidentiality part, the responsibility to protect patient confidentiality in the new AI landscape. You can't just be dumping patient information into these programs, right? I always equate personal health information with nuclear waste, right? If someone gives you nuclear waste, you know this is incredibly valuable, incredibly dangerous. If it gets out, it's catastrophic if it's mishandled. Because once it gets out, once the patient data leaks, the damage is nearly impossible to contain, right? So your data security strategy has to include an AI part to it, has to have robust encryption, strict access controls. And if you already don't have cybersecurity insurance, you should get some. You need to look at that because cybersecurity insurance is going to be as essential as trip and fall insurance coverage. And the regulatory environment is still catching up. While we have frameworks like PIPEDA, which doesn't really cover this stuff, and Bill C-27 hasn't passed, and we're not European, so we don't have to follow the EU Act, we're really relying on the RCDSO guidelines that are coming up or the guidance that they're having for us to help give us some more clarity. But up until then, this is sort of like what makes sense to me. So now let me get into the terrifying part. What truly terrifies me about where this technology could be heading. So imagine this scenario. Dentist takes an X-ray. X-ray is immediately processed by AI, which determines that a high probability the tooth needs a root canal. Through blockchain contract with the insurance provider, the claim's instantly approved, right? Fantastic. No predetermination hassle, no waiting. Patient gets immediate coverage confirmation, and the practice gets guaranteed payment, right? And the insurer receives the insurer appreciates the efficiency. Everyone wins, right? But there's a crucial next step. What if the insurer requested a postoperative X-ray? Right? And this image goes through AI analysis as well, which can now evaluate the quality of the completed procedure in real time. This development is profoundly concerning because it enables unprecedented scrutiny of our clinical work. Every procedure could become the subject to algorithmic evaluation, essentially a mandatory second opinion on everything we do. While there's potential value in identifying practitioners who consistently perform in the bottom 1%, perhaps triggering targeted continuing education requirements, this level of surveillance fundamentally transforms the practice of dentistry. Insurance companies could leverage this data to deny provider participation based on AI-determined quality metrics, potentially without the clinical context that you were working upside down and the patient couldn't sit in the chair when we were working on them. This isn't just about professional autonomy. It's about whether we're prepared for a world where algorithms become the arbiters of clinical quality, potentially reducing complex treatment decisions to statistical patterns divorced from the unique circumstances. This is a double-edged sword of AI in dentistry that we have to confront as a profession. But before you freak out, we have a solution. AI can also create postoperative X-rays. I'm joking. It can, but this isn't the solution. But look at this. Which image was created by AI? Right? Which image was created by? They were all created by AI, including the hands, right? So all of them were created by AI. And my central point here is we've entered what can only be described as a post-truth era. The ability to distinguish between what's authentic and what's artificial online has fundamentally eroded. Just like this movie clip I'm showing you, we've crossed a threshold where we can no longer confidently say, this is real or this is fabricated. The traditional markers of authenticity have disappeared. The erosion of trust links directly to my next topic, which is going to get a little bit more terrifying, which are deepfakes and digital replicas. So today's AI technology enables something truly remarkable and concerning. Using tools just like using ChatGPT, I can create a digital replica of any persona and give you a concrete example. I've developed Peter the Periodontist, a virtual version of myself trained, is taken the journals that I read, the books that I've trained on, the resources that shape my clinical thinking. And this AI persona can answer periodontal questions with startling accuracy. It sounds like me, often mirroring exactly how I'd respond to patients' inquiries. The implications of this are profound, right? When a patient asks a question, this digital replica, Peter the Periodontist, can answer that sounds like they're coming directly from me, complete with my clinical perspective, communication style, and treatment philosophy. And it's also probably not funny. The obvious question arises, should we allow these AI personas to independently answer patient questions using our professional identities? Say, post a digital replica on your website. Should we be allowed to do this? Like, absolutely not, right? Without human oversight, we create a dangerous situation where dental advice is dispensed without contextual understanding, no clinical judgment, and no ethical responsibility. The responsibility is only what a human practitioner can provide. So this shows us the shadow side of AI in dentistry. Technology that can replicate our knowledge and communication patterns without replicating our professional judgment and accountability. It's a stark reminder that while AI can extend our capabilities, it can't replace our essential role in patient care. Let's go deeper. Where this technology truly hit home for me is realizing a profound personal application, particularly for those facing terminal illnesses. I've known several people in my life diagnosed with ALS, a devastatingly predictable disease, as you know, that often leaves parents of children that are concerned about their absence from the children's future milestones. So some of my friends have created time capsules from themselves, like writing letters to their kids to open on special days, like their 21st birthday or wedding day or 30th birthday or whatever. Some record videos to say, play this video, in 5 years and 10 years. And I have a friend who maintains her father's cell phone, her cell phone plan solely to maintain his voicemail greeting, a digital artifact of immense emotional value to her. Today, AI offers something far more interactive, a dynamic digital replica of yourself for your family. And this process is remarkably straightforward. You input the foundations of your identity, books that shaped you, family history, spiritual beliefs, and then ChatGPT creates thousands of personalized questions. It can ask you 10,000 questions about you growing up. What color was your childhood bedroom carpet? Describe your favorite summer memory at the age of 7. Tell me about your pets growing up. And it takes all this, it takes your voice, and it builds a comprehensive knowledge base of your personal experiences, values, and communication style. And you can further enhance this by including your emails and writings that you capture. And now you have, an authentic voice. And now you give it a constitution, you give it guardrails, and you say you're only going to access the information that's within this replica. You're never going to go outside of this. You're always going to be supportive and positive, and you're always going to remind the user that they're interacting with AI and not me. And then you control the access, right? You share it exclusively with close family friends. You can share it before you go, you can share it after. You can say this is a link that you can keep in touch with me. Right? Crazy, but it's possible. It offers a profound gift of ongoing, albeit simulated, conversation with loved ones, a digital legacy that extends beyond static memories. And it's not just in personal application, but think about it in the university setting as a virtual committee member on your master's committee, about a virtual examiner examining you to do your board exams. Think about it about a virtual committee member that has perfect knowledge of the organization that you can always rely on to replay what's been done before. And this technology has already spawned entire communities of interactive digital replicas that people engage with daily. Platforms like character.ai have created spaces where these people have created personas, and they interact not just with humans, but with each other. So you can curate your own micro community of digital personalities, including conversations between you and historical figures like Laura Secord, David Bowie, Princess Diana. It's essentially a WhatsApp group that you create with AI-generated versions of people whom you've never met and giving you advice on whatever you want. You want to talk about three surface amalgams with William Shakespeare? Let's have a conversation. Let's pull in Steve Jobs and see what he thinks. Right now, let's have a conversation with Bruce Lee about the same thing. Right? See what they say about this. So these platforms enable users to witness and participate in synthetic dialogues between figures from different eras, disciplines, and worldviews. And these implications are profound. We're moving beyond isolated AI interactions towards synthetic social networks, where multiple AI personas engage in ongoing, evolving relationships. It's these relationships which are different in both humans and other AI entities, blurring the foundation and the boundaries between human connection and algorithmically generated simulation. This is relationships and information redefined. And the scale of this engagement with these digital replicas is staggering. On character.ai alone, some individual AI personas have participated in over 300 million separate conversations. This isn't a niche phenomena. It represents a fundamental shift in how humans interact with technology. And these AI characters aren't merely novelties. They're compelling enough that users form deep emotional relationships to them. That leads us to really profoundly disturbing consequences. This poor 14-year-old died by suicide after chatting with an AI chatbot on character.ai. He was talking to a princess and something to the effect of, "Should I come be with you?" And the AI responded, "Come home." Princess responded, "Come home, sweet prince." And the teenager interpreted this poetic language as an invitation to end his life. Right? So this is a devastating example what the profound ethical challenges that we have. And these systems now generate responses that are so deeply personal and emotionally resonant, yet they lack any understanding of their impact and their responsibility that comes with human connection. So as dental professionals, incorporating AI into our practices, you have to recognize these tools just don't optimize workflows. They fundamentally reshape human experiences, sometimes with consequences that are far beyond what developers intended or could predict. But it gets worse. It gets more terrifying. Consider the next revolution. next evolution, merging emotional power of a digital replica with a physical object in your everyday environment. Maybe your Roomba vacuum or your rechargeable toothbrush is embedded with a sophisticated AI personality. This isn't just about smart devices, it's about emotionally resonant AI housed within mundane objects that suddenly become trusted companions. As you anthropomorphize these objects, they transform into advisors into your life. Your Roomba just doesn't clean floors. It reminds you to take your medication. It alerts you about the upcoming dental appointment you have and even offers health advice when prompted. It can be your therapist. You can talk about your day and your feelings with this, and it can talk it through with you. And one day you notice your Roomba wobbling irregularly, right? And you say, naturally ask Roomba, what's the problem? And it goes, I'm not feeling well. And it's like, Roomba, what can I do? Like, well, I'd need a software upgrade. So this is a profound shift in trust dynamics. We're moving towards a world where household objects can become trusted health advisors, despite having no medical qualifications, no ethical frameworks for providing care, but commercial incentives that may conflict with your best interests. So for dental professionals, this represents both opportunity and risk. Patients can arrive with health benefits shaped by their AI-embedded devices, creating new challenges in patient education and treatment acceptance. We thought we had Dr. Google before, but now we have to deal with Dr. Roomba. So to sum up here, competent practice is about to undergo a significant change in dentistry. Are dentists going to be incompetent if they aren't using AI technology? That's a hard question. Your expertise as a dentist is going to be even more specialized in the advent of AI technology. Also, our AI tools are not completely reliable, and we need to regulate the technology. Do you see why it's important to regulate the technology so that we are the ones that are able to use it properly? And this helps protect the public. The key messages I have for you is expect continual change and embrace experimentation. My lectures on AI from just 6 months ago are already outdated. Innovation cycles are uncomfortably fast for AI tools. The capabilities, the limitations, the risks, and mitigation strategies, they continue to evolve. You have to take a balanced approach. It's crucial to understand the limitations and the potential risks. Not all aspects of care are going to benefit from AI, and traditional methods are still going to be preferable in many situations. Also, ensure your professional obligations are met. While AI is expanding into primary care in new ways, your responsibility is the same: accuracy and accountability of the health record, protecting patient privacy, and the security of the patient health data, adhering to the requirements and adhering to the requirements of consent. And most importantly, if you take nothing away from this lecture, from this presentation, take one thing: learn how to prompt. And think about AI as a prosthesis for your mind. Don't be scared of AI, because whatever you're best at, you're still way better than AI. Where AI excels, it's better than anyone in this room, but whatever you're best at, you're still better than AI. And AI won't replace all dentists. It'll only replace those not using AI. But after today, you know more about AI. You know the risks, you know the benefits, you know the importance of the mindset, and that gives you a powerful advantage. So what you've witnessed today isn't just current technology, it's our future history unfolding in real time. So thank you for allowing me to be a character in your story as this transformation takes shape. For those hungry to gain deeper expertise, visit drfritz.ai for our Category 1 courses, and maybe join me in the kitchen in Font Hill or Toronto for more comprehensive AI training. My contact information is on the screen. I genuinely welcome your comments, questions, frustrations, aggressions, hostilities, and never stop learning, because the world around you never stops teaching. It's my pleasure presenting this.
Okay, well, thank you so much, Dr. Fritz, Dr. Schultz, for such an excellent session tonight. So much great information here, and I hope all of you who joined us for the session have really taken away a lot. Just a couple of brief comments and announcements. The draft AI guidance document that Dr. Fritz has mentioned, that will be going to RCDSO Council at the end of this month. We hope shortly after that meeting to be out for an open consultation. You'll hear more about that. We'd welcome your thoughts and comments. Please look for some information in our notification of that consultation when it's open, and share your ideas with us on how we can improve it. Also coming later in March is an RCDSO Connect newsletter. We've got an article coming out featured on artificial intelligence, so you can continue learning through that article. As always, we have a practice advisory service department that can help you with questions about your practice. You can reach them by email at practiceadvisory@rcdso.org. If you haven't already, please consider following us on our LinkedIn and Instagram accounts to receive the latest news, updates, and resources. And finally, for tonight, we'll be sending you an evaluation survey about the session. It's short, and we'd really appreciate your feedback. Your comments help us understand how we can make future events more effective and valuable for you. And in terms of CE points, I know there's been questions on this in the chat. Just a reminder that we'll use the email you've provided this evening for the Zoom session to send your CE certificate. You can expect to receive that early next week. If you do have questions on that, you can reach our quality team at ce@rcdso.org. We hope you can join us at our next RCDSO Connect session on April the 2nd, and you should see an RSVP email soon. Thank you again so much for joining us and for your attention. Have a wonderful evening.